Hi guys, it is 3:27 and I'm done at the dentist. You can probably tell because the side of my face is frozen. But that's okay because it's all teeth back there now. Yay! And I didn't have an anxiety attack. And the pressure on my face is pretty bad for my sinuses. But I got through it. I did what Mary on the Fry Life says all the time. Do what you think you can't do. Yeah, do what you think you can't do. That was me today. I did a lot of stuff that I didn't think I could do. Anyways, just waiting now for my husband to call me. We are going to go out for supper, I think. That's what he said. But he doesn't get off work for another half an hour. So I'm not sure what exactly, I'm trying to open my juice. I'm not sure exactly what we're going to do, where we're going to go. I think that's what he's trying to figure out. And that is that. I don't know what else to tell you guys. It's been a pretty crazy day. Trying to get stuff done. So yeah, I think we're gonna go out for supper in a little bit. I'm still in my dentist office in the parking lot. Then tonight, just relax, talk about if I'm gonna go to Vancouver or not, probably. And then tomorrow I have to take that paper that my doctor gave me downtown, which is pretty much where I am now, but it's too late to take it. So that's not going to be fun. And then I have to go all the way back home and get Twilight and take her just into the south side of the city, so not too far, probably 20, not 9, 20, yeah, about 20 minutes from our house. And she's to stay there for a couple hours till she like calms, her heart calms, and then she they can do her blood pressure again, excuse me, so that they can see if she needs to take medicine twice a day or if once a day is good, and if she needs blood pressure medication, because the medication she's on is actually for the heart condition. And I am going to be doing an update videos, like a series of them, probably this week. Well, no, tomorrow's Friday, isn't it? Soon, in the coming week, I would say, about all the cats, because they all seem to have a little bit of health going on. Plus, I'm going to officially introduce you to the kittens. So in that video, I'll explain exactly what's wrong with her heart, because I don't know how to pronounce it properly without having the paper. So if her blood pressure was the very high end of normal last Friday, so this medication that she's on for the heart condition does lower the blood pressure a little bit. So they're hoping that it will bring her down into like the medium high or even high range normal. And then she won't need a blood pressure medication. She'll just need to take this medication. And depending on how much it drops her blood pressure, she may only have to continue to take it once a day. Which I have to say, as her mom, I hope that is the case, because she's not a hard cat to pill by any stretch of the imagination, but sometimes she's a very skittish cat. She's always been a skittish cat, but she's getting a lot better lately. But sometimes she just doesn't want to be picked at and have a pill put down her throat at that exact second. And you guys did see earlier, it's really tiny, but we'll have to see. If it's twice a day, then I'll have to do it before work and in the evening. So at least we'll have a bit of time, if I'm not working right now or whatever's going on with that, for her to get used to it. That also poses a problem if we go to Vancouver. If we both go to Vancouver, because then I'm assuming it's going to be Brad's best friend that's looking after the cats. He's going to actually have to live at our house, because he would have to pill her before work and after work, or like in the evening, the same as we would. If she stays only once a day, then oh, my hand is cramping. Oh, there we go. Then he could just come over after work, scoop the litter, hang out with him for a little bit, give the medicine, Because then Casper would just get his medicine at night, and we would actually go the whole 10 days without Asher getting his medication done, just because most people are not comfortable sticking their fingers in a cat's mouth. And even Randall, I mean, he knows. Oh, there's my husband. So I will be back to you guys in 1 minute. Hi guys, so we figured out where we're going for supper. We're going to actually Smokehouse Place, so I'll get to have barbecue chicken. It's really good. They have cob corn, which is really good year round, but I don't think I'm going to have it. Not because of my tooth, but my face. It's kind of hard to eat. It's going to be hard to eat. I have to take small bites. I don't know. I'll decide. So I'm going to head over there in a minute, but I thought I would finish saying what I was saying. So about Asher and his teeth, whenever we go away, we just leave that time with no medication for his teeth. And the vet's on board with that because, like I said, most people don't feel comfortable sticking their finger in an animal's mouth. I mean, sometimes vets probably aren't. I mean, I don't care. And he's like, we call him the teethy boy because he's like really nibbly. So, but I would never ask Randall to do it. He would probably do it if we, no, he would do it if we asked him, but we've never asked him. And he's looked after Asher many times since we've had Asher, since we adopted him 5 years ago, which is pretty much the same length of time we've known Randall, or yeah, we've known Randall 5.5 years. So yeah, in and around the same time anyways. So even when Randall lived with us, Randall didn't give him his medication. So, yeah, so Asher's won't be a problem. Casper, he could really go without his chews. And I'll explain this in his video too, but his chews is for the arthritis. So you'd think, oh, you need to give him them so that to keep the arthritis under control. It's actually the problem that we have, and why he takes the gabapentin isn't for arthritis. It's for phantom pain in his tail, which causes him to try to chew his tail off. It's crazy. So they x-rayed his tail and his hip and his back and everything, and his hip has, not hip, he has arthritis in one hip. But that would cause him a little bit discomfort. So it's going to, like, he's not going to jump as high and stuff like that. But it wouldn't even be enough to medicate. Like if an animal is just going in for his annual checkup, because he will be 14, or he was 14. He was 14 in October. So when you're going for your annual checkup, and you know, once they hit geriatric age, which I think is 12 or 13, they recommend x-raying just the hips and back every year just to see if there's any dysplasia going on or whatever. And the vet said, like, she wouldn't even medicate it. But the problem is she has to, because he's attacking his tail, because somehow the pain in his hip is deferring down his tail. Now that makes sense that could happen, but I think I have a video, there's definitely pictures on Instagram of his tail is ripped apart. Like, he almost lost his tail. It was ridiculous. But, so he could even go without his chews, even though he can have his chews and his gabapentin at the same time, because the chews are just glucosamine put into a chewy form. So, and then Twilight also gets omega-3s for her skin, well, for her fur. So they get that at night. And actually, I might show you that tonight. Or I might show it to you tomorrow night. One or the other, I'll show you. So yeah, but if baby girl needs to take her medicine twice a day, I guess that means I have to stay home from Vancouver. I'm a little bit scared about being home for 10 days by myself. With the way I've been feeling, but we'll work it out. We'll figure it out. Last time when he went to Saskatoon for like 6 or 7 days. 7 days, I think. He left on a Tuesday, came back on a Tuesday, something like that. My cousin came and stayed with me on Friday, Saturday, Sunday. There's actually a haul up on my channel about some of the stuff we went and bought, and we just hung out and had fun. So I'm sure she would come over again. But anyways, so my battery is getting very close to dying. So I'm going to end it here. I'm going to head over to the restaurant. I probably won't vlog any at the restaurant, but I will either show you the medication tonight, or I will vlog before bed and show you how winding down for bed with my chronic pain is, and my chronic mental health crap. Sorry. I don't mean to call it crap, but to me it's feeling like crap today. And it's my mental health, so I can call it what I want, I guess. Yeah, so how that happens, and then I will vlog again tomorrow and bring you along as I get through my morning routine again. Hopefully without a panic. Hey, that's right. I freaked out over my leg not being shaved this morning, didn't I? And then I sat and had some blueberry tea and whatever. But then, like, yeah, a couple hours later I'm driving, and then I start getting these panicky symptoms. So something was stewing all day. I don't know if it's something in the back of my mind, or I don't know. Anyways, anxiety and panic is a messed up thing. So anyways, so hopefully none of that will happen tomorrow, and then we'll go downtown. I'll take you guys downtown, and we'll drop off my paper, and then we will go to back home and take the baby girl to get her blood pressure checked. So I will check in with you guys later. Bye for now.